Next tonight, the struggle to find mental health care in the capital. Jonathan Culverwell was among an increasing number of Londoners desperately needing help, but his family claim he didn't get it. They say he took his own life because of failures at his local mental health trust. Well, a recent BBC investigation revealed 1,500 beds have been cut in recent years. And according to a council report in Culverwell's own borough of Haringey, up to 8 patients a day are trying to get help, forcing some into hospitals as far away as Yorkshire. Aisha Busk reports.
Say hi.
Hi. What up?
He was very generous with his friends, and there was something in him that always helped out his friends in a way. Compassionate person, very compassionate.
Jonathan Culverwell's mother has fond memories of her son. He worked hard and had a large circle of friends. But in his late 20s, he developed paranoid schizophrenia and began taking drugs. This is Jonathan with his family and friends from North London celebrating his 31st birthday. Just a few months later, he took his own life.
He wasn't talking at all, and he was sort of secluding himself, not just from me, but from the world. I tried to contact the mental health team, and they said until he harmed himself or he harmed anybody else, they can't actually do nothing about it.
But after threatening his sister with a knife, he was eventually arrested and sectioned and spent time in 2 different hospitals receiving psychiatric treatment before being released.
At the time, he was actually on a recall. He was supposed to be in hospital, and we did actually contact them for them to come and get him, and they didn't. So at the end of the day, my brother would still be here if they came and got him.
Jonathan was one of 3,000 patients in Haringey suffering with severe mental health problems. These are the minutes from a recent Haringey Council meeting in which the pressure on mental health services was discussed. It's noted that there are currently 49 acute beds available in the borough, with 7 or 8 people a day waiting for one to become available. It's also written that a patient was recently told the nearest bed available was in Pontefract in Yorkshire.
It shocks me that there's not enough beds. You know, I mean, how do the families feel? How do these mentally ill patients feel? I mean, where are they going to go? Who are they going to turn to?
In a statement, a spokesperson for the local NHS trust said there had been an increase in demand and they are currently reviewing bed numbers. He also said the trust always strives to offer the highest standards of treatment, care and support to patients and carers. A recent inquest into Jonathan's death was not concluded. His family are still waiting for answers.
Aisha Busk reporting there. With me now is Marjorie Wallace, the Chief Executive of the mental health charity Sane. Thanks for joining us, Marjorie. We saw in that report that people have been sent out of their boroughs, even out of London, to get treatment. This problem isn't just confined to Haringey, though, is it?
No, absolutely not. I mean, it's more than a catastrophe. It's a scandal. We've actually lost 10,000 psychiatric beds in the last 10 years nationwide. And it's not just in Haringey. At some points, over the last months, there has been not a single psychiatric bed available in London. Now that has terrible consequences. It means that people are shunted across the country, hundreds of miles, or they have to be sectioned under the Mental Health Act and their liberty taken away, or they are sent back home and they have to fend for themselves with diminishing community services, and then they may be picked up by the police because they may be self-harming or suicidal, and then they're taken to a police cell. I mean, and then so they're doubly punished. I mean, they're very ill people. They need treatment, but they end up being turned away. And at that point, I know of quite a number of cases who've got to the stage where they are suicidal or have actually taken their own lives.
Government cuts have been blamed, but the Care Minister, Norman Lamb, has said that there is an institutional bias in the NHS against mental health. And he says, I'm determined to end this. Is he right, and can he end it?
Well, the only one way he can end it is to change this relentless policy the government has had of closing down psychiatric beds and units, because they say that's the most expensive part of care.
But he's blaming the NHS for doing that.
Yeah, but it isn't. It's a government policy, and this has been going on for a long time. We've been saying this because they've said that all the resources should be diverted into community services. Well, that sounds really good. But those community services are being cut at the same time, so crisis teams have no time to come to a lot of people, and also quite a lot of them diverted to people who are mild to moderately ill. Now that leaves the very seriously ill, like the case we've just heard, with nowhere to go, and their families absolutely desperate, and they are contacting us all the time. It is really unforgivable that we are not providing care and treatment. The government says there should be a parity between physical health and mental health, but as you've just said, mental health loses out, and when they are taken into hospital, they're taken into wards that are either crumbling, unsuitable, they're overstaffed, and then they're sort of discharged and just left somehow to live however they can. And this is putting pressure on people and is really unfair on both patients and families.
Marjorie, it's shocking to hear. Marjorie Wallace, many thanks for joining us.
Thank you.
On to other news now, and an official